Welcome to this week's Roundup from Hill Security Dispatch, the trusted resource for real-time information, analysis, and insights on global healthcare cybersecurity. Over the past few years, the healthcare industry has increasingly relied on connected medical devices to gather, monitor, and share clinical data. While this connectivity offers numerous benefits, it also creates significant cybersecurity risks that can compromise patient safety, including inaccurate diagnoses or incorrect dosages. And any interference with the device's proper functioning can severely disrupt the delivery of clinical care. As evidence of that, a recent study revealed that 21% of healthcare cybersecurity professionals believe that cyber attacks on their organizations have had an adverse impact on patient mortality rates. Considering the vital role that connected medical devices play in healthcare delivery, Lexology, a leading global legal research platform, has just released a report on the top 5 industry trends to watch out for in 2023. Aside from predicting continued investment in connected technologies, with improved due diligence on device security, the report covers the rise in artificial intelligence and concerns over intellectual property, as well as an overview of the current healthcare cybersecurity landscape. Medical device manufacturers are required to follow stringent cybersecurity guidelines and standards, but healthcare providers must also take proactive measures to ensure the security of their devices, including regularly updating software and firmware, conducting risk assessments, and continuously monitoring device networks for potential vulnerabilities. Find out more at hillsecurity.com. The U.S. government released a national cybersecurity strategy outlining its future approach to cybercrime, government cyber defenses, and the private sector's responsibility for cybersecurity. The healthcare industry is recognized as one of the nation's key infrastructure sectors, but has for many years been the leading target for increasingly sophisticated ransomware attacks on its data, devices, systems, and personnel. The National Cybersecurity Strategy aims to create a unified approach to cybersecurity, including coordinating the diverse resources of the U.S. government to safeguard against cyber threats and secure the nation's critical infrastructure, essential services, and digital ecosystem. Built around 5 key pillars, including disrupting and dismantling cybercriminal gangs, shaping market forces to drive security, and forging international partnerships to share cyber intelligence, the strategy should be essential reading for healthcare cybersecurity decision-makers. Find out more at hillsecurity.com. The new U.S. National Cybersecurity Strategy recognizes the role that software plays in ensuring the security of the nation's digital infrastructure and includes broad provisions for regulating software vendors. Under the proposed regulations, software developers will be required to meet minimum cybersecurity standards, including regular vulnerability assessments, timely release of security updates, reporting any known vulnerabilities or data breaches, and providing information on the security measures within their programs. While this is a significant step towards improving the security of the nation's digital infrastructure and is especially relevant for the healthcare industry and its supply chain partners, it represents just one piece of the puzzle. Effective cybersecurity requires a comprehensive approach, including access to actionable intelligence on defending against or responding to impending threats, strong passwords, multi-factor authentication, regular backups, and ongoing employee cybersecurity training. Ultimately, the success of the proposed software cybersecurity regulations will depend on a concerted effort from all stakeholders, including government agencies, private companies, and individual users. Only by working together can the healthcare sector ensure the safety of patients and the security of the digital infrastructure that it relies upon. Find out more at hillsecurity.com. The dark web is notorious for being a hotbed of illicit activity, including the trade in stolen patient health records, which are now reported to be worth 10 times as much as credit cards. Patient health records typically contain a wealth of sensitive and confidential information about an individual's medical history and current treatments, as well as payment data, including insurance and banking details. That makes them irresistible to cybercriminal gangs who use the information to commit a range of crimes, from identity theft, insurance fraud, and blackmail to falsifying prescriptions and medical treatments. The consequences of having one's health records stolen and sold on the dark web can be devastating. Not just the immediate financial impact of identity theft, but also the long-term reputational damage and need to rebuild credit and medical histories. To protect themselves, patients must safeguard their electronic health records, regularly check their credit reports, monitor their bank and insurance accounts for unusual activity, and be very cautious when sharing any personal information online. Healthcare providers can also play a role in protecting the confidentiality of patient health records by implementing robust cybersecurity measures and training staff on best practices for online safety and data protection. Find out more at healsecurity.com. As further evidence of its determination to fight cybercrime, the U.S. Department of Health and Human Services last week released the Cybersecurity Framework Implementation Guide, a comprehensive resource designed to help healthcare organizations improve their cybersecurity posture. The guide provides a step-by-step approach to implementing the NIST cybersecurity framework and aligning it with the unique needs of the healthcare industry. It outlines 5 main steps to help organizations identify their critical assets, establish a risk management framework, and create a roadmap for improving their cybersecurity defenses. One of the key features of the guide is its focus on collaboration and communication, encouraging healthcare organizations to involve all internal and external stakeholders in the implementation process to ensure that cyber risks and their potential impact are properly understood and managed. The HHS Cybersecurity Framework Implementation Guide is a valuable resource for healthcare organizations looking to improve their cybersecurity posture to better protect sensitive patient records, medical devices, and clinical data from cybercriminal attacks. Find out more at healsecurity.com. Thank you for your time. I'm your host, Kurt. For the latest healthcare cybersecurity threat, risk, and alert intelligence, subscribe to our information and insight service at healsecurity.com.